Well, it is a real privilege to be recognized tonight by Physicians for Peace with the 2011 Charles Horton Humanitarian Award. I'm very flattered by this. I am well aware of the legacy of Dr. Charles Horton and the work of Physicians for Peace, as well as a distinguished list of previous award recipients, including former President Clinton, Professor Jeff Sachs, Senator Bill Frist, and the grassroots advocacy organization ONE. I am really honored, humbled really, to join their ranks. Now, while I did not personally know Dr. Horton, I do know that for more than 20 years, Physicians for Peace volunteers have been medical diplomats on the front line of efforts to improve healthcare in underserved communities. That means a lot to me. I want to personally congratulate my fellow award winners, the Volunteers of the Year, and for that matter, everyone here tonight who has made a commitment to Physicians for Peace, and a commitment in turn for a healthier world. As a volunteer, a donor, or a friend, your efforts make a huge difference. I've seen it firsthand. As a journalist and a neurosurgeon, I've seen how education can transform communities, particularly when it comes to healthcare. Rather than healing just one patient, Physicians for Peace teaches others so they in turn can heal many patients. In doing so, you do a lot. You empower individuals to pull themselves and their communities out of poverty, and you can and should be proud of that mission. It's important work, made even more impressive by the fact that most of you take this mission on as volunteers. The need for trained healthcare professionals everywhere in the world today is tremendous. I mean, this year alone, I've reported from humanitarian crises in the Horn of Africa and Japan. I was one of the first journalists on the ground in Haiti after the earthquake in January of 2010. I've seen how dire the situation can become when that need for trained healthcare professional goes unmet. Now, since the earthquake, I've returned to Haiti a number of times, and each time I wear two hats, that of a journalist and that of a surgeon. From my experience in Haiti, I've learned a lot. I've been inspired, I've been optimistic in terms of what people can do, and I've seen firsthand this idea that people can train a healthcare force and that change is possible. I've seen people waiting in line for hours to get a sip of water, having spent 7 days in the blazing sun, and yet they're still singing songs about taking care of one another. That's the sort of inspiration I think the world needs. And by partnering with organizations like Child Fund International, Major League Baseball Players Trust, by working through the Haitian Amputee Coalition, my friend Don Leslie, Dr. Don Leslie does this, Physicians for Peace volunteer, physical therapists have reached hundreds of patients since the earthquake. The majority of amputee patients in the country have been served. It's a remarkable thing. But what I admire most about the work in Haiti is your focus on creating sustainable rehabilitation centers staffed eventually by Haitian professionals. That's how you get a country to sort of build again. By working across the Dominican Republic, the border, you can bring technical training skills to the island and help local clinics build their capacity. These are important relationships that are going to ensure that Haitian patients' needs are met long after volunteers from international aid organizations do return home. And that's just speaking of your work in Haiti. One thing that I've learned, whether I'm reporting from Haiti, from Iraq, Sri Lanka, or even here in the United States, is that we can't fix the world's health problems by working alone, and certainly can't do it by working against each other. We have to work together. We have to talk to one another. Physicians for Peace is at the forefront of those efforts, and with its emphasis on information sharing among regional clinics, your burn care program in Central America and the Caribbean, it's a model of collaboration for other organizations. In the Philippines, I know you've made some great strides in building the local healthcare workforce and in reaching patients in the nation's most remote islands. All of your programs are proof of your willingness to share your expertise, your concern, your compassion with people you really care about, even if you live around the globe from them. As world citizens who invested in improving healthcare for all people, we got our work cut out for us, but we also have many opportunities to make a difference, and that's the source of inspiration. Whatever your role may be, a volunteer, donor, partner, I hope you take time tonight to celebrate this organization, celebrate its remarkable and unique mission. By training healthcare providers around the world, Physicians for Peace volunteers play a key role in strengthening health systems, preparing them to meet the needs of people who really desperately need a hand, not a handout. That's a significant achievement. Again, I'm grateful to be recognized with this award. Thank you all for doing what you are doing. Thank you for this honor. I look forward to hearing even more about the work of Physicians for Peace in the coming years as you continue to grow and work with your partners all over the world. Have a wonderful evening.